there's about 105 of them that impact medicine in one way or another. So that's a huge portion of bills that are being debated at the state level that impact doctors, that impact the healthcare system, that impact public health patients all across the board. Out of those bills, the majority of them we end up playing defense on. We say all the time that we are very lucky to have 4 members of the General Assembly that are physicians. We have 2 in the state Senate that are Republicans and 2 in the state House that are Democrats. And so together they're able to give a message about how some of these bills impact medicine. But the reality is the majority of the bills that get introduced do not come from our doctors who are our legislators. They come from elected officials who have heard examples out in their districts from different individuals. I usually say they're typically one-offs where they hear from somebody, they want to fix the problem they have, they introduce a bill, but they don't realize the global impact it's going to have on medicine and in the healthcare system. So my job, along with Joe Rosado, that I know some of you have met, is to just educate elected officials and let them know how these things are going to work. And then if it's a bill that we think would be negative towards the healthcare community, we try to stop it or make changes to it. And then we have a lot of proactive things that we work on. So I'm going to go through a list of several of the issues that we're working on. Like I said, there's about 105 different bills, so not going to hit on all of those. That would be quite boring for all of you, but I'll try to highlight some of the ones that are the most interesting and the ones that the most impactful. So if I'm not at the State House, I'm usually traveling the state, speaking to different physician practices, different groups. I know that I've spoken to the Alliance before. That's really how OSMA hears firsthand the issues that our members are having, is by getting out in the field, talking to practices. A lot of time when I'm visiting practices, they don't know an issue that they are explaining to me is something that we could fix legislatively or something that we could fix from the regulatory perspective. So I try to spend time and just sort of tell practices, talk to me about what's going on in your environment, and then I try to pick out the things that I think we can do proactively to help them. So traveling the state, I'd say the biggest issue that is across the board we hear from every single physician is issues with the insurance industry and the regulations that are coming directly from the insurance industry. Yeah, people laugh because they're like, well, what is this thing? Oh yeah, it's the insurers. They make the lives of physicians and the lives of patients really challenging. And a lot of times we partner with patient groups. We hear from patient groups that say they're paying for a healthcare benefit that they don't really believe they have access to. They believe they have insurance, but then they go to use it and there's all these barriers, or the cost of drugs are so astronomical and the insurance coverage for them isn't there. And so what good is insurance product if you can't actually use it when you're having a situation? So we have a series of bills that are getting at some of these issues in the insurance space, and I'll say there's massive opposition to them from the insurance industry, no surprise. But I'll say what they have been doing is really highlighting for elected officials how terrible some of these issues are, that patients experience, that physicians experience, that our loved ones experience on a daily basis. We have a bill right now that we're proactively pursuing that would create a prior authorization gold card program, where if you're a provider who gets your prior authorizations approved a certain percentage of time, it would give you a 12-month time period to bypass the prior authorization process. We know from talking to patients and physicians that prior authorization is nothing but a time constraint to somebody getting the appropriate care that they need. OSMA did some comprehensive prior authorization reform several years ago, and when I was making the rounds at the State House at that time, I had to start every meeting with explaining to an elected official what prior authorization was. Here's the process. It's supposed to be this cost containment tool, but it's used for everything under the sun. Now when I go in and meet with lawmakers, every single one of them has a personal experience with prior authorization, which shows to me how completely out of control the system has gotten. I travel the state and hear examples of docs that are getting prior authorizations that have to go through the prior authorization process for diabetes supplies, for Z-Packs, for birth control, for all these things that are actually very low cost in the healthcare space. So if prior authorization is meant to be a cost containment tool, it appears that there are significant abuses that are being made to that by some of these low-cost things that are now requiring prior authorization. So we're trying to create a process to bypass it. But I'll say the bigger thing in that bill to me is because I think the concept of a prior authorization gold card is a great idea. I think conceptually how it would work in the practice environment is probably a little challenging because there are so many different insurers and they offer so many different products that it may be a little challenging to figure out all the logistics behind it. But something that we do have embedded in the bill is comprehensive data collection. So on a yearly basis, health plans would have to send to the Ohio Department of Insurance every single thing that requires prior authorization, how often they're approving it, how often they're denying, and how often they approve on an appeal. I honestly think us getting that specific data is what is going to lead to comprehensive prior authorization reform. Because right now at the State House, it's like he said, she said, we're on one side of the table, the insurers are on the other side. They say the reason why there's so many delays with prior authorizations is because physicians don't include all the data that's necessary or all of the patient medical records that are necessary to create a better process. I actually was meeting with somebody yesterday with the health plans who told me all the issues with prior authorization would be, I can't even say this with a straight face, it's so outrageous to me. All the issues to prior authorizations would be solved, number one, if physicians used electronic medical records. Okay, everybody does that. And number two, if insurers just had access to all patient medical records. Just a comment. I literally got out of that meeting and felt like I was in a twilight zone. How could you, first of all, every 9 out of 10 doctors are using EHRs, and if they're not, they're probably very close to retirement, or they're a cash. It doesn't matter what that, everyone's using EHRs at this point, okay? It's not 15 years ago.
No.
And the idea that an insurer would get access to a patient medical record, they tried to say, if they could just go in and pull out the information from the medical record they need, then they'd be able to approve prior authorizations without any type of a hassle or a burden on the provider. Laughable as I say that. So prior authorization continues to be the #1 priority of issues that we are focusing on. Several other things in the insurance space. We have a bill that would prohibit insurers from doing mid-year drug formulary changes. We know that's a huge issue for patients. They pick their, if they have the ability to pick their insurer, they're picking it based upon the coverage of a drug. And if during a calendar year that drug gets removed, that's a huge issue for a patient. Patients can't change their insurance mid-year, so why should the insurer be able to change their benefit? There's also a bill dealing with what we call copay accumulator programs. So many of you may know that patients a lot of times, if the drug that they're on is very expensive, they can get a coupon card from a manufacturer that will help them pay for the cost of the drug. Drug, let's say, is $2,000 a month. Patient's deductible is $10,000. A lot of times, the pharmaceutical companies will give them, a copay card that has $10,000 on it. So they can, for the first 5 months, pick up their drugs with that card. They hit their deductible, and then they can get the cost of their drug for the remainder of the year. What we're seeing happen now is insurers are not allowing that money from a coupon card to go towards paying a patient's deductible. So from my perspective, it's almost double dipping with the insurers. They're getting that money up front from the manufacturer when the patient's paying for their drug, but then once that card runs out, the patient doesn't have the money to pay for their deductible, and then they're still left with this massive deductible. So we're trying to put prohibitions on that says, shouldn't matter where you get the money from, shouldn't matter if I'm paying for a drug for my parents or if they have a coupon card from a manufacturer. We need to protect the patients. We all agree the cost of drugs are completely and utterly out of control, but the person that's getting stuck in the middle of the fights between the pharmaceutical companies and the insurers are the patients. And if they can't pick up their drugs, they're not going to be healthy. For some of them, these are life and death situations, so we need to protect their ability to get the drugs that they need. We also are supporting a bill that would require insurance coverage for biomarker testing. Some biomarker tests are newer out in the system. They can help really zero in on more defined diagnoses for patients so that they can get more specialized treatment. We see biomarker testing not being covered across the board right now. So the bill that we have would require coverage for biomarker testing. That's just a handful of things in the insurance space. We actually have a lot more issues, but those are kind of the key ones. Another huge issue that we deal with at the State House is scope of practice. So as many of you know, the legislature is the one that draws the line between what it is a nurse can do, what can a doctor do, what can a physician assistant do, what can a therapist do. Every General Assembly, we see numerous bills get introduced that try to expand the scope of practice of the allied practitioners. We support team-based approach to care with a physician leading the healthcare team. They are the most educated and trained. Every physician that I talk to across the state will say they cannot do their job without the allied practitioners that work with them. But the idea that an allied practitioner would stifle off their care and provide care independently is something that's a concern to us. So we have several bills right now that we're working on in this space. We have 2 new individuals who are trying to get the ability, 2 new allied practitioners that don't exist anywhere else in the country, that they're trying to use Ohio as a test space to create licensure and practice. One would be called a Certified Mental Health Associate, who is supposed to be similar to an APN or a PA, but focused just in the area of mental health. Now, our issue with the bill is that the bill is a 300-page bill, does not outline 1 ounce of education and training. So while they say they are going to be similar to a PA or an APN, they don't exist anywhere in the country. And so without having specifics in the law about what their education and training looks like, there is nothing that would stop, Ohio State from having one program and the University of Toledo from having another one, and Neomed from having a separate one, and then none of them are connected because there is no national body that's looking at the education and training of these individuals. So that has been a very complex issue to try to explain to elected officials. Everybody needs more, we need more providers in the mental health space, 100%, but we need to see what education and training looks like in order to allow somebody to be working with our mental health population. We also are working on bills with the physician assistants who want to change their name from physician assistant to physician associate. I find that very confusing. I don't know why that would be necessary. I think from a patient perspective, that would be very confusing for a patient to walk in and say, hi, I'm a physician associate, gives the impression that you are a physician, that you work with a physician. So that's something that we have concerns with. We also have the other new allied practitioner that's trying to get licensure in Ohio would be called an advanced respiratory therapist. They'd basically be like a respiratory therapist that has the ability to prescribe drugs. Now this one does have education and training already outlined. The Ohio State University has a program that they are doing education and training for. So that one is one that we can at least see what it looks like and how similar it may be to some of the additional prescribers that we have in Ohio. And we're kind of working through the specifics on that legislation right now. Do have concerns, but that one is easier for us to, again, look at what education and training looks like and kind of develop a scope of practice based upon it. And then we do have a bill that's pending again that would give CRNAs a pretty massive scope of practice expansion. We have been dealing with CRNAs for basically as long as I've been at OSMA. It's a pretty concerning piece of legislation. They want the ability to do all sorts of drug administration within the walls of a hospital, but explaining this to the General Assembly that a CRNA is basically just created to help in the OR and in the immediate pre-op and post-op time period. We really don't need CRNAs roaming the halls of the hospitals administering drugs 2 weeks post-op to a patient. Even a surgeon wouldn't be doing that. And so there's a lot of things that we're trying to explain to elected officials about why scope of practice expansions for CRNAs are actually very, very concerning, because they're their own allied practitioner that has a very specific pathway where they were created to administer anesthesia. And so scope of practice expansions outside of that don't really seem to make a lot of sense to us.
Along that line, like that, I worked in the OR forever and ever. The certified anesthesia associates.
Yep.
Because there's turf wars with the CRNAs who now are in the doctorate program.
Yes.
And now they have DNP programs for that. And then they have these certified, they're anesthesia associates.
Yeah.
Assistants.
Yep.
And some hospitals hire them, some hospitals don't. But they're on the same pay scale and the same responsibilities really that the CRNAs.
Yeah, the only big difference between an anesthesia assistant and a CRNA is an anesthesia assistant has to be supervised by an anesthesiologist, where a CRNA can be supervised by any physician specialty. But you're right, they operate in a very similar manner. Their education and training is very similar.
They're not nurses, they're not.
Right, yeah, they're not nurses, but yes, their education is very similar. This has become an issue at the State House too, because the CRNAs did get a small scope of practice expansion a couple years ago when we were dealing with this massive bill that they wanted. We were able to come up with some language that gave them the ability to do some things in the immediate pre-op and post-op time period, only if their supervising doc signed off on it, only if the health system said that it was okay. So we put a lot of guardrails around it. The AAs did not get that same scope of practice, so now at the State House it becomes very confusing to elected officials where they think a CRNA is massively above in AA, and an AA is significantly less educated and trained, which is not the reality of how they actually work in the practice setting. So that has also become confusing for elected officials, but lots of conversations around the State House about AAs as well. The other scope of practice issue that has not gotten introduced yet, but will be shortly, is naturopaths are going to try to get licensure here in the state of Ohio. I actually can't wait till I get to testify against the naturopaths at the State House and just use example after example of the things that they call medicine that are clearly not medicine. And a super interesting trend that we've seen around the country with naturopaths is they created themselves to be alternative medicine providers. Okay, they don't really typically work in a healthcare setting. They don't prescribe medications. They don't do any of these things. Around the country, though, we're seeing a trend where naturopaths want to start. They have prescriptive authority now, and there's a trend around the country for them to have the ability to do surgery. And so I tell people, well, they were created to be this alternative medicine, not medicine, but so now why all of a sudden are they trying to prescribe medications? Doesn't that completely go against their education and training, whatever education and training they got? So that's an issue that I know is going to pop at the State House here in the next couple of weeks, and one that we'll be active on. Last just few issues, we're always very active in the public health space. Since the pandemic, there have been a series of legislative initiatives introduced around vaccines. We are actively working to ensure that individuals have access to vaccines, that childhood vaccines, we know that there was kind of a drop-off on some childhood vaccines during the pandemic. A lot of kids weren't going in for their well visits. So vaccines continue to be a priority for us, along with the cost of drugs. I have a meeting next week where we're meeting with an elected official who wants to know how we can bring down the cost of EpiPens, what can we do about the cost of diabetic supplies and things of that nature. So working on a lot of initiatives around that. And then I'll end before I hit on some of the election stuff with just Medicaid and Medicare reimbursement rates continue to also be a high priority for our organization. We were fortunate after a lot of work to secure a 5% rate increase for physicians in Ohio in the Medicaid space. We were able to get about $400 million new dollars from the state of Ohio invested into Medicaid reimbursement rates. That was a priority of OSMA's last year. It just went into effect this January, so we were really happy to see that influx of new money come into Medicaid reimbursement rates. While we were able to get that 5% in the Medicaid space, we do know at the federal level this continues to be a huge issue. I was out in DC in February advocating to fix the flawed payment rate that we have for physicians with Medicare. Our CEO was just out there 2 weeks ago, again advocating to fix it. We have to stop cuts in the Medicare space to physician reimbursement rates. We do want to tie Medicare rates to inflation so that there's some type of an increase that's happening every year. So that's a priority of ours. We are obviously partnering with AMA on that, all the activities that we do at the federal level, but that continues to be a priority for us. And then lastly, as Kathy mentioned, we have all of these issues that we work on in the legislative space, and one of the reasons why we are so successful legislatively is because of the generous contributions that we get to OSMA's PAC. I know a lot of you around the table are PAC contributors, so we appreciate that. This year is an election year, and so we have all of our Ohio House is up for re-election. Half of our members of the Ohio Senate are up for re-election. Obviously, we have a presidential election this year. We don't weigh in on presidential elections, but we do have Supreme Court elections up this year. We have 3 individuals for the Supreme Court that are up for election, and so lots going on in that space. OSMA is starting our process now where we send out candidate surveys to all of those who are up for election. Fill out our surveys. They answer a series of questions about where they're at on certain medical issues. Our PAC board will get together this summer to review all the candidates and then come up with endorsements. So we'll be sending those out at some point, probably during the July time period. Our board is meeting towards the end of June. So just pay attention. There's a lot going on with elections this year. The Supreme Court is obviously going to be a big one. And then, like I said, we are able to be very successful around the State House because of the generous contributions that we get to the PAC. With the PAC, I'm at fundraisers for elected officials every Tuesday and Wednesday night. Sometimes it's numerous. fundraisers in one night. We give to both political parties. We give to candidates who are the most supportive to the issues that we work at around the State House. We, with the PAC, were able to get in the door and have conversations with elected officials that we wouldn't otherwise be able to get in the door and have conversations with. We're able to go out into their districts and see them during the summer and go to district fundraisers. And so it helps us, the more we are around and the more every time an elected official turns around, whether it's at the State House or whether it's at a political event and they see myself and Joe, they're always reminded, oh, OSMA, what's OSMA got going on? What do the doctors say? Every time they see us in the halls of the State House and at events, they're coming up to say, how's OSMA doing? What are our doctors thinking? Are you guys in a good space? Are we helping you? Are we hurting you? What can we do to make things better? And so, we appreciate your contributions to our PAC and would just ask for any support that you can give with this year being an election year. So with that.
Are there any questions?
I just have a comment. Linda Mullet from Lucas County. My
Yes, Linda.
husband's an oncologist, in private practice, and, their drugs are super expensive. It could be $42,000 for an injection. One of the problems they've been finding is they get pre-authorization from an insurance company. They give the drug, and then the insurance company denies. So then they, for reimbursements, they bought the drug, maybe 4 months or 4 weeks ago, and they could be waiting 4 or 5 months to get paid. So that's one of the problems my husband finds in private practice with his pre-authorization issues. The other problem they have is he finds that Medicaid patients, the university settings deny letting them in because of course, the low reimbursements. So that's a really big issue because, in my opinion, the state or our taxes are paying for those university setting hospitals, and they're not taking the poor patients. It just seems like an oxymoron. And my third comment is I do data collection for cancer research, and I had a patient, I read her chart, it was for Eli Lilly for breast cancer, and the woman decided to take mistletoe instead of going for chemotherapy, and she had stage 1 cancer, and she ended up dying in 6 months. So that homeopathic medicine, I'm just seeing when I review charts, is a detriment for some people's healthcare. So those are my 3 comments.
Yep, great, I appreciate that. The one that I will hit on is the prior authorization. So we actually passed a law in Ohio, and I believe that this is being significantly abused. And if it is, or you're hearing examples, it needs to be reported to the Department of Insurance because we fought tooth and nail to get a provision into Ohio law that says a health plan cannot retroactively deny a prior authorization based upon medical necessity. So if you went through the steps, you have a patient, they need an infusion, you requested prior authorization, your prior auth gets approved, patient comes in, you do the infusion, then you go to submit reimbursement, they are not allowed to do a denial based upon them then trying to say, we don't think that was medically necessary for you to do that, or something along those lines. The only time that they really can do that is if it was shown that the patient was no longer covered at the time of the actual service being provided to them. So we do have a law in place for that, but it is a law, that's an issue. Retroactive denials are an issue that I hear constantly from providers, and that's super frustrating to me because there is a law in place that prevents some retroactive denials from happening. So if you hear examples of it, that needs to be reported to the Ohio Department of Insurance. They do have a complaint process where you can get right online, file a complaint with them. And so the Department of Insurance is complaint driven. So if they don't actually hear complaints through the portal, then they say there must not be any problems with it. I know that it's really hard to go through those steps of filing a complaint because it's really time consuming. But to the extent that you can, I think that will make things a lot better.
Right,
Oh,
sorry.
yes.
So I'm just curious, with FTC and banning non-compete agreements,
Yep.
how do you think that's gonna play out? Do you think that's really gonna happen?
So
Because
that has
I
been.
just think that's a big thing for our.
Oh, it's huge, yeah. So for those of you who don't know, the FTC has decided that they wanted to put a ban in place on non-competes. Independent physicians, and here's the problem with it. The ban with the FTC does not apply to nonprofits. which most of the complaints that we
The nonprofit
hear.
hospitals.
Exactly.
Almost every
Most of the
hospital.
complaints that I hear in the non-compete space are abuses that happen within health systems.
Yes.
It is very rare that you see an abuse happening in the independent physician spot. With independent physicians or large physician practices, their non-competes are pretty limited, 10 miles, 2 miles, they're really actually workable. But the FTC does not believe that they have jurisdiction over nonprofits, which is pretty much every hospital. So for us, it is a massive issue because I think it's gonna allow non-competes to continue in the health system
Yeah.
space, but then prohibit them with physician practices, which is wildly concerning. I'll say there were over 25,000 comments that were given to the FTC on these rules, most of them in opposition to them. The US Chamber of Commerce has already filed a lawsuit against the FTC this week to try to stop the rules from going into effect. So this is gonna get tied up in the legal space for a while. I think there's a lot of folks that believe the FTC is not clearly defining things. There's a lot of grayness in the rules. They also said this week that the ban on non-competes will not apply to individuals who are considered executives
Yes.
who are in a policy space and making over $150,000. I don't know what a policy space means because the FTC didn't clearly outline that, but most physicians make over $150,000. And so I don't know how that piece is also going to impact independent physicians and things of that nature. So there are a ton of questions associated with the FTC rules. We are following them. Our legal counsel has been actively engaged in them. OSMA commented on them the first time around. And it's something that if there are lawsuits, I'm sure that we'll be actively engaged in that process too. I would be surprised, knock on wood, if it actually ends up happening at the end of the day, because I think there's so much grayness in the rules. And then you also have to take into consideration, I don't know what will happen, it's a presidential election year. And so if there's a different president in January of next year, he may also make this rule go away. And so there's a lot of factors that are being taken into consideration right now, but it's a huge issue for OSMA and one that we've been actively engaged on.
I have one quick question. How does OSMA, I know how they felt historically about the whole legalization of marijuana.
Yeah.
You know, it was for medicinal, and now it's supposedly they voted to have it legalized, but there's nothing that's been done about it, so how does that, I mean?
Yeah, so OSMA opposed issue 2, creating recreational marijuana in the state of Ohio. We still have a policy in place that says that we believe there needs to be more research done in the medical space. It's hard to do research in the medical space since federally it's still classified as a Schedule I drug. But that's where our policy is we believe there needs to be more research. So we are technically still opposed to also medical marijuana. That being said, we have been actively engaged with the state on what the medical marijuana program looks like, because it is our providers that are going to be physicians that are going to be recommending marijuana. And so we were very engaged on the bill that passed that created the medical marijuana program. We've been very engaged on any bill that has been at the State House since then to make sure that while we are still opposed to it, we're crafting it in a way that makes it work for physicians that are going to be recommenders. But we were opposed to issue 2. I think issue 2, there was supposed to be a state law that passed to kind of implement it. There's a lot of infighting between our House and the Senate right now, and so they're not coming to an agreement. I think that we could see the framework of issue 2 be hashed out through the regulatory process. That's currently underway right now. I think there's a thought to maybe just take the medical dispensaries that we have here in Ohio and give them a dual license to also do recreational. But I think there's gonna be a lot more to come on that in the next couple weeks.
Any other questions? I'd also like to know, there's a space for everyone here to be, one second.
Okay, sorry.
One second.
I'm sorry.
There's a space for
Trying to
everyone
get out of your way.
to be involved. So they have reorganized the structure of the legislative side. I enjoy being on the legislative committee. That's been wonderful, but they've broken it down to different specialties. And they're always looking for that person who is out in the real world, the spouse and so forth, to participate in those meetings as well too. So if you have any interest, Monica, you can go through me and Monica and so forth, to be a part of that as well too. Like let's just say it's the family physician acquisition group.
Yeah.
They meet, you know, a couple times a year. And then they go through the legislative bills that pertain to them. And then they make a recommendation that then goes to the legislative board. And it's just a nice way to be heard. And it's a great opportunity if you're interested in doing that as well too. Monica, thank you.
You're welcome.
Okay, so this is like a little, like when you're at the State House, things to put in your bag. There's an umbrella.
Thank you.
There's, you know, the wheel, you like the wheel.
Very important.
Yeah,
I love the
yeah,
wheel.
a
Thank
cookie.
you, Kathy. That's so nice. Thank you, everybody. Really appreciate
Well,
it.
thank you. Thank you for everything. Okay, so we're getting to the point where let's do a quick picture. Is this a good time? We're at, help me with the time. We're a little early on the picture, but I think that would be good. Yeah. So, and then we'll do Rachel right after that. Is that all right? So if we.
I like being between you and lunch.
Okay, great.
That's the really great
It'll be
spot.
it'll be good. Yeah, we still have a lot to go. So quickly, what we're gonna do is go into the boardroom. You're going to, I think 4 or 5 people are gonna sit up front in the chairs, and then people are gonna gather behind. And it's just a very quick picture of all of us together. Sounds good?
Good job, Kathy.
Speakers and everything, all right? Thank you. So follow me.
She wants to catch everybody before some of us leave
Leave.
at 1:30.
Or we have
Well,
like green
we
things in
always-
our teeth from lunch.
We always point.
We
forget
to
take the picture. That's the thing.
Yeah, no, we-
You're leaving and go, oh, there's only 5 of us left. We forgot to take the other picture. It's like we missed a couple.
Thank you so much.
A lot going on. Yeah, yes. Very, very frustrating. I know, it's wild. Yeah, I mean, they're basing it, so all the commercial plans base their fees off of the Medicare fee. So if that starts to, well,
More than that, so how
No,
did
is
they
it-
even come up with that? I don't understand, I mean, I thought it was supposed to be within like.
Okay, we're this way. Oh, I'm sorry.
there's nothing that says the rates have to be within a certain percentage,
Okay.
but typically they are.
Cause like Medicare's like 141 for this one procedure,
Interesting.
and all of a sudden that is now.
Sarah, would you like to do
Even
bylaws?
I can.
Can we do that quick? And then-
Whenever you quit, whenever you want, my dear.
Thank you, everyone, for the Zoom people for staying with us.
Taking your bathroom break while we were getting our. I have not yet figured out on Zoom how to get just my Facebook when I need to edit. Yeah. So you just turn off the instant, right? Yeah, that's what it is.
Yeah.
But, you know, if you like
A cute, oh, that'd be cute. I've not done that.
But a lot of people do for the whole meeting, they just stick their face up there, and they're not there, I mean, they're somewhere in the room, presumably. Kathy, and I apologize, I forgot to start this at the beginning, so we have from Monica on. But I see that you're
But it
recording
looked
the
really
Zoom.
good.
And we're recording the Zoom, so, sorry.
Yeah.
And I said,
Why don't we bring up Sarah Sanders, talk about the bylaws, and then right after that, well, thank you for.
Alright. This won't be too long, but I have a couple of important points. So, Chris and I are bylaws co-chairs, and nothing was really presented this year to amend the bylaws or any bylaw amendments offered, but we did have discussion. And so, there's some things that we will be taking and carrying forward to discuss and perhaps present next spring. One thing is about the vice president's position in the bylaws, and we're blessed. We got a vice president this year, so. But going forward, looking at that position and whether there's still a necessity for it or adjusting it and those things. So we'll be discussing that next year. But more importantly, I don't know if everyone recalls or remembers, but last year at this meeting, a committee was formed to look at the future of this alliance. And the committee was composed of Chris as chair, Diana, Gretchen, Tom, Mary Beth, and Jen. And so at the last nominating committee meeting, we had discussion about the future of this alliance, and we were talking over some different things, and I said, you know what? I will chair a task force to talk about this going forward and look at this coming year. And Jen goes, oh, you know, we have a committee for that. And I said, no, I didn't remember because I was not. So what we are doing is, I'm going to refresh a few people's memories, but Chris is being relieved of chairmanship. I will chair, but she's still on it. And Gretchen has been relieved of serving on it. Tom, Mary Beth, and Jen. And so we will be meeting primarily via Zoom to discuss the future of this alliance. You know, about, yeah, Diana, you're on it. Didn't I say your name? Yeah, Diana. Oh, yeah, Diana, yeah. Everybody that was on it from last year is on it this year, except Gretchen was taken off and I was added, and Chris and I just changed positions
was
as far as who's
demoted.
in charge.
I was doing, and that's okay.
And I know Chris is, no objections, right?
No.
So we'll be looking at that, and I'm hoping to reach out to several individuals, kind of gather some data, gather some information, look at some of the other states, what they're doing, what they have done, what's worked, what's not worked. Last night, Kendra brought up some things, some points about growing interest among the younger population for being more in-person, more face-to-face kinds of things. And so perhaps we've put it off long enough to explore that valley and come back out. The valley we've been in of declining attendance and participation, and perhaps there's some way to come out on the other side and be able to hand it over to the next generation. So that's what we're looking at doing with this committee. Anybody else want to serve on it? We are happy to take input or have thoughts. I am happy to hear your input on this going forward. But some of the people I'm gonna, you know, pick their brains. Jacqueline. Okay.
immediate past president of the AMA Alliance, Rachel, of course, Ron Jaggers, who's the incoming president-elect for the AMA Alliance, but he was also the membership chair. So pick his brain. Chris is his brain, of course. And Pat Choi, who used to be executive director for the AMA Alliance, and I have a good working relationship with. So just kind of pick some brains and kind of get some thoughts to go forward. So I wanted to fill you all in on that and let you know that that is what we're looking to do next year. So thanks to Jeannie and Carol. I will definitely come pick your brains.
Thank you, Sarah. Appreciate that. And thank you for everyone for serving on the committee as well, too. That sounds great. All right, without further ado, I want to introduce Rachel. Yes, the AMA Alliance President. Rachel Kunich hails from North Carolina, but is a Midwestern at heart. She grew up in Iowa, on an Iowa farm, as the youngest of 6 kids. She earned her bachelor's degree in chemical engineering from University of Iowa and an MBA from the University of St. Thomas. She has been active Alliance member all levels since 1994. After completing her tenure as president of the North Carolina Medical Society Alliance, Rachel has contributed her energy at the national level for the past 12 years, serving 2 terms as Communication Council Director and as Secretary prior to her election as President. Rachel's husband, Ben, is an internal medicine physician. They are empty nesters. Rachel has worked in process and product development for 3M. She currently is employed as a product development engineer at Celgar. Okay, thank you. They manufacture lithium-ion batteries. By the way, we're doing that in Ohio, so any interest in,
I wish, believe me, I wish they'd buy American separators.
Oh.
But that's a whole nother discussion.
Yes. It is a pleasure. Over this past year, I've got to know Rachel in person as well as in Zoom. And she's a motivating person to get people around the country interested in the Alliance, as well as really finding out what kind of interesting things everybody does and helping to move us all forward. So I'm really happy that you're here. Thank you.
Thank you. Technology here, so I'm gonna be a two-screen person. Great, okay, I'm gonna go ahead and share screen here. So let me work on that. And I used to, you get spoiled by like 3 screens, right?
Yes.
When you're down to 1,
Yes.
it's a struggle, so. Let me go ahead and share this and we'll get in slideshow word of the year. All right, great. All right, well, thank you so much, Kathy, and I'm really happy to be with you guys. The Midwest feels like home to me, and I think of Ohio as the Midwest. So it's very comfortable for me to be here. And I know you guys are all familiar with the AMA Alliance, but our mission is to build healthier communities by connecting physician families and collaborating to educate and advocate. This year at our board retreat, we actually came up with core values. We found that we were not enunciating those. So it forms the words serve you, support, educate, respect, value, empower, and unite. We also have just operationally, you know that the Alliance operates at our county, our state, our national level. And at national, we are operating under, historically we had a 6th system operations, but we've added a 7th system, and that is advocacy and legislation.
So we've elevated that part of the AMA Alliance to its own council, and Kathy is on that council, and that's great. So we've went from this 6 systems, which we have like events, membership, communications, programs. Now we have advocacy and ledge. Of course, there's finance. Everybody has to have that, and governance. So all those systems. So that's kind of how we operate at national. So I'd like to just bring to you what I see the value of the Alliance for our counties and states. And really, I think as the AMA Alliance, what I want to tell you is that it's really not so much what can you do for national, but really what can national do for you? And how can we make county and states stronger? What can we do to provide resources for you that are going to help you be strong and thrive? So one of the things we started in COVID, right? We really ramped up the Zoom calls. And I just wanted to share with you the very first Zoom call that we had was in September, and commemorating National Physician Suicide Awareness Day. And we had a gal, Betsy Gall, and I don't know how many of you joined this call, but we opened it up, and as Kendra alluded to yesterday, we opened this up to any physician, spouse, and partner. And actually, I'll be honest, my sister-in-law, who has no relationship to, except that, you know, her brother-in-law is a physician, joined the call because she was, you know, interested in this. But it was a great call. Loved that we could actually bring that to more than just our members, and really kind of a membership recruitment initiative. The next month we had Barbara Bradley Picard with Vera Bradley, and she, you know, she's a co-founder. She was a lot of fun to have on that call. And then we became a little more internally focused as we talked about nominating. We gave AMA Foundation and HEI, our affiliates, a chance to talk. Now, in January, we had a gentleman from the AMA talking about the recovery plan for American physicians. So these are all open either as a member or to anyone to join. And they are also, those recordings are housed on the members-only website. And there's actually a quick link on this slide, we can get there. You guys know, hopefully, you know we do a magazine, which is the brainchild of, I think back Joe Terry's board retreat of Donna Ravito. And I am an engineer, right? And so thematically this year, I've challenged people to be a catalyst, okay? So our first edition was be a catalyst for growth. And I don't know if you guys, as a member, you get these, you know, in your mailbox, otherwise it's available online. Be a catalyst for change. And the newest edition, Be a Catalyst for Growth, for Good, actually just went live yesterday. So if you go to Physician Family Media, it's live. So we like bringing this magazine. It really has great content, both with authors from diverse backgrounds. So we really love this magazine. We do have a e-newsletter, The Link, which we come out with monthly. Chris is part of the communication team on that, so thank you for that. We have a members only, a public Facebook page. We also have a Physician Family Alliance community page, which kind of came out of the Physician Family magazine several years ago. We just wanted to also bring more leadership training with Jacqueline. I don't know how many of you guys attended like board boot camp, Confluence 2.0, so we kind of wanted to go back to the good old days. If any of you guys went to either Confluence or leadership development, right? Great, we used to do them twice a year of all things, right? So kind of wanted to bring that back, but update it for, you know, the advantages of digital and virtual technology. So I was talking about Confluence 2.0. If you did not join it, it's actually also on our members only website. If you want to ever go back and listen to some of these modules. The first day we had, it was a little bit more technical, I guess, in focus. There's a guy talking about how to use Canva to develop some kind of cool graphics that can elevate your message, right? We had a gal talk about Facebook, how to do Facebook Reels. Another one talked about leveraging ChatGPT, which I have to admit, I occasionally do. Because as an engineer, I'm a technical runner, I'm a creative runner. So sometimes I have to, you know, pull on a little bit ChatGPT and like, and modify it, so I'll fess up there. The second day, we had a gal talking about aligning or designing alliances, a generic alliance, to avoid conflict. Like how you do that up front so you can kind of take care of take care of how you're organizing. Dave Will, who is with Prop Fuel, talked about member engagement, and then Chad Schuckman, who's our CEO for the company I work for, talked about kind of like time management and project, how to get things done. His thing was being lazily efficient, which I always strive to do, and I don't think I'm very effective. You may not know about this, we still have health promotion policy grants. They are available year-round. They're just a little bit of seed money, $300, $500, but if you have a project you want to go and get going, it's still out there. It's alliance money available for you. We also have awards, and yes. Yay!
We don't know anything about that.
I saw it in Kathy's just like, but it's good. But we look forward to hearing all about that at the annual meeting, so congratulations on that, and that's awesome. So yeah, in all these different areas, we like to celebrate and promote what good the alliances are doing. One thing we did start wanting to do is to promote on our website that there is stuff going on across the nation. So we have a master calendar that we would love to add events to. It's always a challenge to keep up with everything and make sure it's updated. So we strive to do that, not always get everything out there, but we're trying to. We also have, if you look at the landing page for the website, there's an alliance map, which then shows the active alliances, state alliances. What we'd like to do is actually, if you have, if there's a state alliance that would like a landing page, we would offer to give you a landing page so that they could basically do a contact. So if you have someone who moves to a new town or a state or whatever, they have some way to connect with Alliance. This is still being developed, but it is out there and available if you'd be interested. I mean, your website is great, yeah. But we should really link.
Yeah.
We need to make sure we are linked to you.
Yeah.
And it's interesting just logistically. Do you guys ever find sometimes it's logistics and these little things that get in your way of really accomplishing so much? So we just have to stay attentive and we'll do that.
Hey, Rachel, if we wanted to put something on the calendar,
Yes,
who do we contact?
yes. So you could email it to info@amalliance.org.
Okay.
And that's our generic, it goes to our admin. You can always send it to president,
Nah.
if you want, but yeah, it can go to Jody.
Okay.
And actually, the person who's been shepherding it is actually secretary.
Oh.
Dinah's been shepherding that, just to watch out when things happen, yeah.
And I should know this stuff. I'm always sending Rachel an email going, where do I find the thing on the website? Because I go and I'm like, where do I find the map?
I can see the look. Kendra.
Yeah,
Kendra's
where's the
moving
map?
there.
Where's Jamie's map?
It's on the landing page, so go to the.
But it's not, it's the public
It
page.
is.
Oh,
We-
It's
not
on the
sign
public
in.
one.
We
Got
need
it.
to move it
Okay.
up, it's on the public, yeah.
Gotta go
landing page.
back.
Yeah.
Sign out.
Sign out.
Yeah, you have to be out of there.
Cool.
So, and also in conjunction with like the Confluence, we've launched this Leadership Academy, which is kind of like a CME for volunteers, right? To kind of amp up our skills, and we'll recognize folks that have attended Board Boot Camp. I did we had a Board Boot Camp reboot, so basically offering what we had available on the website from last year, and Confluence 2.0 this year, and then coming to a session at the end meeting, and then we'll be happy to celebrate folks in the Leadership Academy. Year 2 cohort. So we are in year 2 of a 5-year strategic plan. It was, the foundation was laid at the Board Boutique in Vegas that I joined from the floor of my bathroom. In the dark. Yeah, it's the morning I was supposed to leave for Vegas, I'm like, I'm not feeling well. And I tested, and sure enough, I was positive. And I'm just thankful I didn't make the where I could have been spending $300 a night to lay on the floor. I could lay in my bathroom and be, miserable. So it was a difficult one. So I was not really as active in developing that plan as I would have liked to have been. But this year, we really tried to operationalize it and reduce it down to a plan of work. And actually, if you go to our website, you'll see that strategic plan is out there, if you'd like to look at it. We're using that also to develop rap cards, kind of like about the Alliance that gives kind of what we're doing, what we're about now, and is updated for that strategic plan. Again, we're trying to give more resources for our state and county alliances. We really are trying to do that. And one thing I wanted to do this year was to rebuild the project bank. And I don't know if you guys all remember Project Bank. So we kind of, we've had ebbs and flows, so I wanted to bring that back. Barb Savage and a team looked at award winners through AHEI and through our awards and tried to basically, we developed a standard format, a Google form that people could input. So if you go out to look at the Project Bank, you'll see that it's a consistent format, and it's open out there for you to put your projects in as well, and then we share them with folks. So I'd like that to continue to grow. We kind of laid the foundation and it's populated now, but please look at the Project Bank, and it is on the members only website. I have to get in through it's behind the wall. So I would welcome you guys to look at that. And one thing I wanted to do was to leverage our past presidents and have a mentorship program. And I just have to say, I didn't get that done. So as I joined your group, maybe we can work on that next year. Sue Ann Greco was helping me with this, and it just is like one thing I didn't get it to. So just because we know we have some really awesome resources in all of these. So yeah. Again, I alluded to at really elevating advocacy and legislation, and you'll see in your packets the scope of practice wheels, right? So that's one thing. Yeah, it's great. And also, we're going to have a panel of presentations at the annual meeting, a good hour, where different folks are going to talk about their advocacy passion. So that will be a nice thing there to share. And you guys have heard about the Physician Family Experience Survey and the great work that Kendra and all of her collaborators are doing on that. And I really think, that's gives us a bright future. I think if we do things right around the survey, I think that's going to be an awesome resource. And I just picked this up. So that's awesome. We do have, and I know Kendra talked about the ebook that's out on the website. So it is available. The Voices from the Home Front, and it's how many pages? It is quite a few. 200.
At least 200.
Yeah.
We collected 1,600 comments that we put into this cover.
Wow. Kendra. Thank
I
you.
read a lot.
You did, yeah, you did. So, what can you do? If you are not a member of the AMA Alliance, I would ask you to join us. I'm going to be honest. I have pins to give out. I will be happy to give you any. Come and join us. We're a great group. It helps us all to connect, and together we are stronger as our state, our national. We are all called to be ambassadors of the AMA Alliance, not AMA Alliance, of the Alliance. Of physician spouses, right? So engage with us on social media. We also like to promote our affiliates. That's the AMA Foundation. And AHEI, that's the Alliance Health Education Initiative. They also give grants, but theirs are a little bigger, so you can get more money from AHEI. It doesn't have to be an alliance, but with any health project, their grant application window is from January 1st to February 28th. So if you have something in mind, think about that. They're also doing fundraising, of course, and just last night they had a virtual Kentucky Derby party, which I registered for. Of course, we were doing other things at 7 o'clock, so I'll have to find out how that went. But now at our national meeting, they'll have their Grow the Grants, and that's where the various folks that have been selected for receiving grants will get even more by people's donations and votes at that annual meeting. And finally, I would love you guys to come to Nashville. We are back there again this year at the same spot in downtown Nashville. I really love the open feel. It's all glass. It's just really, for the size that we get at the annual meeting, I think it feels like a nice space for all of us to be together. We are this year having even more business conducted virtually. So our virtual business session will be by Zoom, May 21st and 22nd. That's Tuesday and Wednesday, noon to 3. We've got some speakers lined up. Then we will conduct the business, including bylaws, as well as nomination and elections. So part of what really Jacqueline and the nominating committee wanted to focus on this year was reducing barriers to service, right? Because it's like, hey, we want you to serve, but by the way, you have to spend a whole lot of money to come to the annual meeting, which it is what it is. Hopefully we're coming to annual meeting for other things, but you know, how do you get younger members to come when we have a young family and they can't spend a few $1,000s to come to the meeting? So really it is opening up and saying, you know, how do we make this more approachable for our younger members to become part of the organization that's going to move us forward. So we're doing that virtually, and then we'll be in person May 31st to June 2nd, and there we're going to get together, celebrate, have good speakers, get to connect with each other, enjoy Nashville. It's going to, you know, so like and of course, installation of officers, which is a good part of the business, right? That's the great part. That'll happen on Sunday morning with Pat Klecki and her team, and Kendra's on this slate as a director.
Yes, she
So barring, you know, nominations from the floor that don't knock her out, she's gonna be in. We do have not, you know, so we do have that, so there's always that option. And I think it's gonna be a good year next year, so. And with that, I think, I just thank you guys for giving me the opportunity to be here.
Thank you. Rachel?
Oh.
We have something a little for you.
Oh,
Thank you. This has been an extraordinary year. You've worked so hard and been all over. I'm not sure how many states you've been to, but there's been, and just all the details to all the meetings and things like that. So we really appreciate it. And this will fit in your suitcase. And then-
Oh, it will? Oh my
Yeah,
gosh.
There we go. Oh, there.
Thank you.
Thank you. Thank you.
Thank you, thank you.
All right.
Oh, you guys, I forgot to tell you one thing. Can I bring one more thing? So one of the speakers in the thing we're doing at the annual meeting, we have a Jerry Rosario that was here
Yeah.
with the Discos, right? So he's gonna be coming to Nashville, which I'm really excited about. And I had breakfast with him this morning. I didn't realize that he was in the area. He also has a children's book. He and his daughter wrote this, and it's really trying to give encouraging words for young ladies. So I just thought that
That's
was
great.
interesting.
I
Yeah.
had
So
no idea.
so I said, Jeremy, bring this to
Yeah.
in the meeting. I
Yeah.
think you'll have some people that will be interested. So anyway, I just
Oh,
wanted
that's
to
great.
show you guys this. So it was really nice talking with him. I think this is going to be a great annual meeting. So come, register. See me if you want the early bird registration code. I might give it to you.
That's all right. That's all right. Okay. All right. Well, we're gonna do something a little bit different, and so many of you heard Kendra Harvey yesterday evening, and her background is phenomenal. We're just so glad that she was able to be with us last night, and then today we're gonna do something a little bit different. We're gonna sit in some chairs. We're gonna I'm gonna interview her a little bit, just do a little Q&A about some of the questions that kind of hit us for that. But some of the people, it looks like we may have lost a couple of our participants, but just to talk about Kendra just really quickly, is a professional life blogger, speaker, leads the survey experience, which has been great. She's been active in outlying positions across the community since 2004. She's, we talked about her husband, got married when they were third year as a medical student. And so she really saw the uniqueness and differences of physician families, medical families, and what that's like. And so I'm sure all these years has been just like gnawing at you, like, oh, what is this all about? And I love how you were researching and finding nothing, and then, you know, just going at it and connecting with people. So why don't we join, because they can see us, I think you all can see us, and they can see us on Zoom as well, too. And I'll bring our little, so people can hear as well, too. So, perfect. Good spot for you. Yeah, this is gonna be a little loud, but, well, thank you so much. Yeah, it makes it really fun, yeah. So just to kind of, can everyone see, okay, now our backs are with you, but are you okay? Or I guess you can see us up that way. Put your microphone wasn't there last night. And, you know, the survey, you know, was a great opportunity. So many people participated. And then I bet there were some surprising things that came from it where you were like, whoa, wait a minute, I wasn't expecting that.
There were some surprising things, and I think for a lot of people, they think, you know, once we have more money, so especially like when we're talking about the resident families, once we have more money, then all of our problems will disappear. And we did see, you know, an increase in satisfaction with life as that changed, but what we didn't see is huge changes in the amount of income. So you're aware of the research that exists that after like $75,000, granted this was from a couple of years ago, so that number might have gone up a little bit, is that no matter how much money you have after that, your happiness doesn't actually change. So I was actually kind of surprised, because you would think beyond that at a certain point you would see greater increases, and those weren't there. And so it really is, again, driving home, especially for our young physician families that are in that early part. It is difficult, but regardless of what specialty you choose or where you live in the country, that just doesn't make as big of a difference. So that was one of the surprising things. The other thing that we saw, and this was, I wish we would have asked a couple of more questions on this, but we asked specifically, so we asked, you know, the general, what is your overall life satisfaction? And they would provide that with a score. And then we kind of had them break up that a little bit. So we asked them about their satisfaction with their family life, with their emotional health, their physical health, their mental health, and then we asked about the sexual quality of their life. And when we looked across the board at every demographic and group, we saw at the very top, everybody was the most satisfied with their family life. And then the next three all were like 1 point from each other, and that was their emotional, their mental, and their physical health. So that was just a little bit lower than family. And then we see the biggest drop across all ages in the sexual quality of life. And so it's like we should have probably asked some more questions to figure out what is going on there. But that is a room for improvement in all of our families. And then when we look at, you know, yesterday we talked a lot about time being an issue. And if you're not spending a lot of time together and you're not face to face, there's probably a lot of other things that aren't happening that are causing some friction in your relationships.
Well, I like the 90 minutes. I mean,
Yeah.
that's a great opportunity to think about, and how you kind of thought about that too. All of a sudden, with the driving and so forth. Yeah.
Can I make a plug for the speaker on the second day of our virtual meeting is Kim Beckham. Did I say that right?
Yeah.
Kim, yeah. Right, so she's gonna speak a bit about like rekindling and fostering your relationship, so.
And finding that time, there's, where, if you just keep looking, you know, through and navigating through and going, oh, this is the time we're driving, or this is, and the conversation has to be different too. It's not just like, I'm picking up so-and-so at this time, and, right. Getting in, like, how are you doing, and what's our life goals? Recircling about those things.
I'm glad you mentioned that, because that's one of the things that we figured out when we had, I mean, we're usually with the kids all the time. It's like the conversations that you have are different, but we realized we never had enough time to actually finish a conversation. We would start a conversation and there's somewhere to go, or somewhere else to be, or there's a call for work, and it always gets disrupted. And it's like you have to have a block of time in order to have a conversation that you can start and see through even.
Yeah, and I like the idea where you mentioned, you know, having, you know, seeing a counselor and so forth is a great idea, but then you came to the assumption like, oh, we just need time to spend together, and.
Well, it made us make the time, and it's like, oh, well, we could just do this on our own, like, we could make the time for ourselves, but we didn't, like, you don't think of it because you're working.
Microphone's going in and out.
That's right, that
I
is
will
right.
add one other thing, because we talked about this last night, is kind of the impact that sleep and exercise have, and that's like for general well-being for all of us anyway. But my husband and I, we wear smart rings now to track our sleep, and I originally got it for him because I was worried, you know, we're all worried about our husbands and our physicians, and, you know, are they healthy and are they getting enough sleep? And it turned out he was getting more sleep than I was, I just didn't know it. Until I was wearing this, and now I can see, oh, and that really affects the way that I feel and interact with my family. So those, statistically, those wore out. The more sleep
Smart
you're
ring.
getting,
How
more
comfortable
exercise.
is it, Kendra, to
Oh,
wear?
I wear it all the time, day
Is
and
that right?
night.
Because I mean, people wear their watches, and I just
Well, yeah.
think, I can't wear my watch at
No.
night, but a ring.
I'll send you a copy, yeah. It's amazing. Yeah, great data.
Oh, do you also?
Yeah, that's great to know because sleep time.
Yeah, it's called the Aura Ring. It's a health monitoring ring. So it monitors a range of things, your activity, so it replaces a watch or a heart monitor. It'll track your sleep, it'll track your cycle if you're still cycling, or if you're done with that, you can still see changes in your temperature. It has a stress monitor, so during the day you can find out how stressed does my body feel, and then it will remind you to like take a moment, relax. You have a quick meditation that you can do to kind of bring things down. But it's just, as you increase awareness, especially when we were talking about that 90 minutes, just like being aware of that like this is a crucial amount of time. If I can average approximately 90 minutes, I'm going to be feeling better in my relationship. I'm going to be feeling better about the contributions that I'm making. I can just feel better. So I love that.
I think data is great, and also that it's right there in front of you, and what's important about that is that we sometimes don't even see it. When you're in your regular day and your heart is racing and you're stressed about something, and we don't, after a while, it just becomes a norm.
Yeah.
And this makes you stop and look and have to realize it. And at night, I mean, I don't know how many people have done it where everybody goes to bed and you're like, okay, now I'm going to regroup everything for tomorrow.
There's actually a term for that. It's revenge bedtime procrastination. And so I saw this with myself and with a lot of young physician families is that they'll spend all day taking care of people, and then when it's time to go to bed, they're like, this is my time. And so they're exchanging something that they think is good, but then they're also depriving themselves of sleep, which then starts the cycle all over the next day of being really tired. So being able to prioritize sleep at night when we're supposed to be sleeping, and finding times to make room in the day for you to get done the things that you want to do. It's tricky, but it has a name. Revenge bedtime procrastination.
Revenge bedtime
I
procrastination.
spend all day doing things for other people. This is my time. I'm gonna procrastinate going to sleep so I can do what I want to do.
For sure. Well, that kind of talks a little bit about the three things that you would contribute most life satisfying. You kind of talked a little bit about that, but did you want to add any more?
One of the things we did talk in the presentation yesterday is that when we did this regression model, and because I'm not a statistical, I mean, I didn't do the statistics, she showed me the chart, I'm like, okay, I can see what that is. Whatever the regression model is, it is, life satisfaction. How fulfilled do you feel as an individual plays a huge part. And then obviously we talked about maintaining your relationship and then creating a community. And those things all kind of tie together, like which comes first? I don't know, pick one and start that cycle. As your relationship gets better, you might want to spend more time with your friends because you're not trying to hide what's going on wrong at home. As you do that, you may be more fulfilled because you're getting outside, you're doing something, you're participating, you're volunteering with your alliance.
I do think people don't tend to talk about their personal life at home because people assume it's so easy and rosy, and so then you're like, well, I don't want to see that in their eyes that I'm complaining about something that they don't see, and those struggles. When your spouse comes home and it was a horrible day at work, meaning someone may have died or someone has bad news, what that impact is on your family when they walk in the door and how that goes. And that's, sometimes you have to just sit with that and keep that to yourself.
Yeah, sometimes we can do that, and I think also it gives us an opportunity. We have to put forth a little more effort to find those key people in our lives that we can share that with. If it's something that our spouses told us is heavy on us, and perhaps we can't have that conversation with them right now, is there somebody else that we can have that conversation with? And if we don't have somebody in our life that's like that, then it is on us to then go and, where am I going to meet people? How, you're going to have to try a dozen times or more, but keep trying until you can find somebody who you can share that with. Or also, this is another great plug for counseling. Find somebody who you can pay to listen to you if you can't find somebody.
We've also made a pact too, and we've kind of learned this over the years, Ron and I, is that if if the feeling of feeling down from some bad outcome of some sort happens and it lasts longer than 2 weeks, then that's time to go for help. And that's the spouse, saying, hey, I still see that you are carrying this with you. And just being alerted to that and making those pacts as a couple, I think is, you are that safety net for them. And they should do that for you too, because same thing, you have the stresses and so forth. If it seems like you have not moved on from something, then that would be,
Yes, absolutely. Do that.
yeah, it's a good thing. It's been a good thing. Yes, for sure. Okay, so what was the most common piece of advice from the survey? Could we talk a little bit?
We can. Rachel mentioned the book, and we didn't get to that last night either. So at the end of the survey, so you can imagine the thousands of people who took it, at the very end of these 90-something questions, we asked open-ended questions where they could leave comments. And so we asked specifically about, what advice would you leave for a medical school family? What advice would you leave for a family that's in residency? What advice would you give somebody who was just starting a career in medicine? And then what advice would you give in general to anybody who's part of a medicine family? And then we grabbed all those together and sliced them up and organized them into, this is advice from medical student families to medical student families, from resident families to medical. So you can kind of see where this person is in their training when they're giving particular advice. And so that's broken up into different chapters. And as I mentioned, I can't remember exactly how many pages. It's a lot of pages. It's a lot of pages. But they they did follow some common themes. And a lot of them, in the early years, we're talking about finances, about how to make the most of what you have. We also had several that were talking about community and the need to build a community wherever you are and to find them quickly. We had others that were talking about low expectations, like learn to lower your expectations, learn to kind of titrate, like we talked about last night, your life is abnormal. It's like, don't compare your life to your friend's life. And this happened, a good friend of mine during residency. And so again, residency being the time where they're working the most, they're not available, you're alone a lot, you've got little kids. And my friend was in a similar situation. She was married, she had little children of the same age, and she came to me one day really distraught because her husband was moving from a 5-day week schedule to a 4-day schedule, and she'd have to put the kids to bed on those nights by herself. And I was just like, huh.
Yeah.
We don't have
Yeah.
a life.
So?
I know. I'm trying to feel sorry for you, but I wasn't very, it's sometimes hard to be compassionate. And so learning to have, you need to have a wide variety of friends to let some of that go, but to recognize that your life is different. And you don't know that when you join this life. You don't know that it is going to be different, because what you see, we talked about last night, what you see in the movies and what you see on television is completely different. It's like, oh, if only it were like that. Like everything, I just watched the movie Doctor Strange the first time. And Doctor Strange is a neurosurgeon.
Right.
And I'm like, what is this? Like, this is not real.
Yeah.
This is beyond.
Yeah.
But there's just a lot of good advice. Again, it's really interesting to see the perspective of how that advice changes as the person is farther away from medical school. And it gets, there were lots of them that said join the AMA. So we had lots of plugs for joining your alliance. And sometimes that was like, just join the alliance, which is also great. There's a wealth of information in that book. And so we do have it available online. On the members only site, you can get it, but you can also get it on the public page. If you just go to program, actually, I don't know where it is on the public, it's on the public page.
Yeah.
There's a drop down.
There's a
You just
drop
go to
down.
Physician Family Survey, and there's a little button that says get your copy of the book, and you can download the book right from there. So you can take a look and see.
That's great. That's great. Very helpful. Well, it also makes us talk about also, as you're mentioning, the residents and how we can be supportive of the spouses and also finding them and allowing, the medical, hospital
hospitals and so forth to when they're, see that this is needed for, to have access. And so once we get them, I love the idea of small groups and meeting people and, coming together and mentioning what's happened in the past.
I think that this is one of the things I thought about last night after our meeting, and I didn't mean to slam on my Facebook groups or anything that came across that way, but really being able to provide lots of different opportunities, and maybe those kind of are gateways where people might be curious and interested. And the first time I showed up to an Alliance Zoom meeting, I didn't know what I was gonna expect, and it was a little uncomfortable because everybody there seems to know everybody, and so being able to sit with a little bit of discomfort is also something you have to learn to do when you're trying to come to a new group, and you're nodding your head like,
No,
you
I
just
think
don't know.
that was the
Same
thing, I
in
think, I
person.
remember the first time I went to, I think like a regional meeting, it's like, why do I feel like I don't, I'm on the odd person out, right? But I think that was like, we should take note of that and make sure whenever we invite new people, we make sure we are
Yes.
purposely drawing them in,
We need to
right?
remember that it
Yes.
feels really awkward, and this feels like a foreign country
Country,
because
yeah.
they're talking about things I don't know about. They all seem to know each other, and really reaching those new members and making them feel welcome. Because if they can stick it out, I'm glad I kept coming.
Yeah.
I kept showing up. It's like, it's all right. It's okay to be awkward a little bit online, through Zoom, and then you just become awkward in person, and it's okay because they're all so lovely. But really creating a pathway of opportunities. How can we provide different opportunities so we can eventually
They have to.
get to membership and get to those face-to-face interactions that really do make a difference. Yes, sit down with my emergency contact, or if I have a problem, can I call you, Kathy? Or, mentoring and really developing our young families.
Well, and young families also, we're parents of 5 kids each, so, that feeling of when you're sitting at a meeting, oh my gosh, my phone just went off, oh my gosh, yeah, that's, okay, because they're not gonna call Ron just because, he's got a cold at school or a fever or something. And so that, for us to understand that and be supportive of that.
Well, and one of the other things that I didn't know earlier is, and I went to a meeting, it was a national meeting, and there were some children there. It's like, oh, I didn't know I could bring, not knowing how it works, and everybody planning, assuming that, of course, everybody knows that you can bring. There's a lot of things that your potential members don't know that you're taking for granted because you know. But there's a lot like, oh, I can bring my kids to this, and it's not a problem. Nobody's gonna mind if there's a little baby or I have to sneak out to feed a child or take care of something.
Right.
Really making it a welcoming environment.
I'm glad you said that, because, we set out flyers and things like that for the game last night. It would have been nice to say, babysitting welcomed, or, children welcome, something of that sort, so it becomes a regular, ongoing opportunity that way.
In the back of your mind, just because my kid might not be able to come with me everywhere, somebody's might need to come.
Can I say something about the ebook? Because I proofread it before it went live, right? They threw everything
That's
in.
right, you did.
But I love that you didn't take out negative comments.
No.
I mean, I'm just going through and most of it's like, hang in there, it'll get better. Residency is the worst, it'll get better. You can do this. And then there was like, run away now.
Get out now.
Get out now. Go. It's not worth it.
Yeah.
It's like you included them all. And so, I mean, while those made me laugh, then when you think about it, it's too bad. That couple may be headed for divorce. You don't know, but they're just like, run away.
Or, like we talked about yesterday, the economic realities of a physician coming out of training. I mean, this is gonna sound, when we were in residency training, for the person who was in charge of my husband's program, she basically had a castle and then a second home on a ranch, and we're like, there's no way, this is not our reality. And it's even more so for our new graduates. It's like, what they're going to have to do just to pay off their loans is just unconscionable to me. It's like, when they started it, especially my husband's program between medical school and residency, that was 11 years. So think of how much can change from the time you start and you think that this is what's going to happen, and then you get out, and that's not what it is. And it's like, well, I've already invested 11 years, and so this is what we're going to do, and we're going to make the best of it. Which is also lovely, but just understanding that lifetime just on the amount of data that we collected. So again, we had all of those people take it, 94 questions, and there's a dozen different ways, like the doctor who asked a question last night. It's like, yeah, with just this data sample, we could spend a long time parsing all of that out and finding correlations and unique ways to discover. But then also, children, or digging in on sex within a physician family or physician marriage. There's all sorts of different avenues that we could go, and there's it could be forever and ever.
Makes sense.
But what we're hoping is that we're not necessarily the ones who are doing it
Right.
forever and ever. And that's kind of why not the pressure, but kind of the internal pressure to publish something, so we get more people interested in it, who do that for a living, who that is their desire, or even the AMA Alliance, as we start introducing them to our research, then that they can begin partnering with us. Like, yes, we'll help provide you with participants, and then you can do the study of it and give us, you can return the results for us.
Yeah.
It'd be nice.
I'd like to open it up. Does anyone else have any questions around the room that they wanted to ask that kind of
I
seems
was gonna comment on Rachel's thing, because, the first time I ever went to like a regional meeting, North Central meeting, they had some kind of mentoring program where one of the girls contacted me and like, I'm kind of, for lack of a better term, you're a big sis.
Yep.
She introduced herself online, whatever. When you come to the meeting, you're gonna sit with me, I'll introduce you. And it was wonderful because I didn't feel like, even though I knew people that were there, it was like, here, I'm Sarah, and, we're gonna do this, and this is how, whatever, sit with me at dinner, and I thought that was wonderful, because then it got me going back for a few years to that meeting, so.
That is excellent.
So for Nashville, we do have some people that are first-time attendees, and that's exactly what we need to do. Yeah.
That's great.
Yep.
That's great.
Good, I'm excited for Nashville. It's gonna be, it'll be my second annual meeting. So.
Okay, yeah.
I have a comment, but it's not as much a question but a comment. I don't know if we have just a couple minutes. But Kendra, to your point about the first time that you attended a Zoom meeting and feeling the awkwardness and the whole schedule and all of that of being married to a doctor. I was out to dinner 2 weeks ago with two of my closest friends. We all went to nursing school together. They both still work as nurses, and they have grown children. So we were talking about schedules, and they were asking about, how my kids were doing, and, our oldest is a second-year internal medicine resident at Ohio Health here. So, and it was one of my best friends, one of the women there, her son is getting married, and my daughter wasn't able to come up for their bridal shower because she's working, and she's one of my nearest and dearest friends. We were each other's maid of honors, yet not her still, and being a nurse, her still not understanding our schedule, because when I was telling her, like Danielle had been on a schedule where she worked 2 weeks of ICU nights. So I said, this is what her life has been like the past couple weeks. With a broken wrist, mind you. She started a shift in the ICU at 4:30 in the afternoon, got home at 7:30 in the morning. Did that for 6 straight days. Then she was off for Easter. Then she did it again for another week. Then from there, she came off Friday morning, slept for 3 hours, flew to Atlanta for a conference for 2 days, and from there, flew to Raleigh for another conference. And the look on their face was like, wow. And what I was thinking of was, you are nurses. You work with doctors. You've known everything, like, and they pretty much know my schedule and how John wasn't around. I mean, when you have a doctor, spouse who's working holidays and weekends and calling, John just changed his schedule. After 38 years, he's no longer taking call and working weekends. 38 years.
But physicians have the mask of, they're not gonna share all that, right? Don't you think? I mean, they are keeping it all together.
Yeah.
Residents or whatever, right? They're trying to keep it.
And the
appearance.
nurses know them at work as the one in charge. And they have a good working relationship or not, but that's the persona they know. They're not thinking about you, even though you went to nursing school with them.
Right.
It's like if he's there, he's not home.
So it was just another one of those, for me, light bulb moments. Again, they've known me since we were 18 years old.
Oh, yeah.
They've been with me through so much. And so anyways, I think nowadays, I think people, on another note, to put yourself in those uncomfortable situations, I see the younger people not wanting to do that as much.
Yep.
And I keep trying to tell our kids, like, you have to put yourself out there. You're only gonna grow if you go into those awkward situations and get over that hump. And I watch, especially a lot of these young kids that I work with, and just get out there.
That's what I was gonna say, even before COVID, but with the digital technology and children and teens spending so much time on their phone, they're linking that to increased levels of depression and
Yes.
anxiety.
Sure.
Yes.
Oh, yeah.
Yes.
And not being able to be in the same room with other people and make
Yes.
eye contact.
Yes.
It creates
Yes.
real, strong feelings of discomfort.
Yep.
Yeah, and they said isolation, the highest rates of
Anxiety.
isolation ever, and you have all of this right here at your fingertips, but it's so scary.
Yeah.
So thank you for sharing that.
Thank you for your comment.
Any other questions? This has been great.
Thank you.
Yeah.
We appreciate it. Okay, I have to find my place. So our plan next is, with the installation, but I don't see Linda. Oh, fine.
How
Yeah.
about if I text, may I text
Oh,
her?
that
Yeah.
would be.
And you-
Great.
Is Joyce on, or is
And
Joyce
Joyce
on?
will not be able to
Okay.
do it, which I don't know if that, yeah.
But Linda, get Linda back.
Yeah. So if we could, let me just look here. Yeah, why don't we, could we take you wanna take a little break and then?
Let's take a 5 minute.
Yeah,
That's what I
yeah.
can do.
and
Let's just get
5
minutes
so
off.
that everybody knows. Bring it on to-
Yeah, we did a great job with that.
While we're on break, so this was one of my favorite comments.
Please.
Medicine is like a cult. Get out as soon as you can. None of this is healthy or normal or worth it. I'm just like, whoa, okay.
She's right, we did leave all the singers in.
I'd turn back if I were you. What was that? The cowardly lion holding its tail, and the sign says, I'd turn back. Which made me laugh, but I'm on the other side of all that, so I can laugh. It's like when you see the children bawling in the store, and the poor mom is, because you're in public and the kid is being a brat and they're trying to manage, and I'm just, I'm just smiling, going, yeah, been there. Nothing I can do to help you because the kid doesn't know me, but hang in there.
She is. And our youngest is graduating.
I just sent an email to info at Lions South. I'm so glad they came up with me tomorrow as I get older. Do it when you're older. So I just noted that Franklin County, Mahoning County, and Montgomery County need pins in Ohio. Lucas and Lake are there.
That's the way we do it.
Yeah, so. And I
Our
think
son's
they're
girlfriend.
Is that all? That's it.
No, it's not here.
Stephen's gone.
Are you certain?
Trumbull's gone.
There's nobody to the south. Everybody goes,
Okay.
Dayton is north.
Dayton, Youngstown, Columbus, Meade,
Okay.
to the table.
So we had kind of
I'm tired, cannot figure out why. I slept great.
What Sarah was talking about with the task force, because I don't believe Kathy was on. Oh, no, she was. She was? Oh, good. We just talked about something about that.
Anybody else need a pin? That doesn't
So
matter.
I know it's all.
No, I've got
You
one.
guys have more than.
I've got one.
You know, I have so many pins that I could join the clown
Yeah.
jacket society, you know, the clowns that have like jackets.
Somebody has to just text me before
Yeah.
the meeting to go in the drawer and.
Remember your pen.
Remember my, I have a tape on it. You know, you can only wear them once a year or twice a year if you go to national, yeah.
Stupid thing on
Yeah,
because,
it's like, I wanna wear it, let me know.
yeah, because where else can you wear it?
I know, so it's like, I forget, and I'm like, shit, I earned that pen, let me wear it somewhere.
I did remember last year at Nashville, I just having a little tin, I just took the whole tin, and I rode with Sharon Sheffield, and she didn't have any pins, I said, oh, well.
You want a few? Here,
You want AMPAC or AMA or?
yeah, which one do you want? Well, I kept losing the fount, no, they
You know,
brought,
I should pause this, you know.